your audio. We also are set up as a roundtable. So we will start out with a brief introduction, then have some expert presentations, and then an overall discussion in which we will address your questions. So if you have questions, please type them into the chat box. The presenters may answer questions as they go along, but most will be held till the discussion period. So once again, thank you for joining us and welcome to the webinar, Rising Above, Empowering Your Workforce Against COVID Delta and Other Workplace Communicable Diseases. The webinar is being presented by the Acheson Group, Homeland Health Specialists, and Advantage Health. I am Lisa Lupo, the Director of Communications for the Acheson Group, and I will be moderating today's webinar, for which we have an expert panel of 3 speakers. Ben Miller, the Senior Director of Regulatory and Scientific Affairs for the Acheson Group, Abhi Andli, President and CEO of Homeland Health Specialists, and Chris Keekel, co-founder and CEO of Advantage Health Corporation. So let's start out with the question, are you prepared for fall? Just as businesses began plans for bringing people back to work and schools started to prepare for fall's back to school, the Delta variant took hold in the US. When you add to that the general uptick of flu and colds and other respiratory viruses that commonly hit in the fall, you can have a tsunami of issues just when you were hoping to return to some semblance of normal. So because of this, it's really important to have a plan in place to ensure that your workplace is adequately prepared. What does that mean? What can you be doing to keep your workers, students, and families safe and your business safe and healthy? As you will hear from our speakers, it will take a multidisciplinary approach. So this means understanding and then educating your employees on the state of the pandemic and risks of workplace transmission, considering your policies for testing, vaccination, and masking, communicating with your employees on the changes and providing mental health resources, and applying all this to other workplace communicable diseases. So to get us started, Dr. Ben Miller will provide an overview of the state of the pandemic.
Thank you, Lisa, and welcome everyone. Just by way of a little background, Lisa mentioned I'm a Senior Director of Regulatory and Scientific Affairs at the Acheson Group. We've really been working on COVID-related issues all the way back to probably February of 2020, where some of our clients had product and movement in Southeast Asia. And so we've really been working on this topic since the beginning, and certainly have worked with a variety of industry segments, primarily in the food industry, but also in other manufacturing settings, as well as with colleges and universities and elementary through kind of K-12 settings as well over the last 18 months. And so certainly bring hopefully the context of experience and having seen the science evolve over the last 18 months around this topic. I mean, appreciative of the fact that you've joined us this afternoon or this morning, depending on where you are. I know this is a topic that is forefront in a lot of people's minds, and at the same time, I recognize that probably all of us are experiencing some COVID fatigue at this point. So glad to have you here. Hopefully, you're going to learn something from, I think, a multidisciplinary approach. We wanted to talk about some of the risk management strategies that I think we're familiar with and sort of why those matter, maybe even more now heading into this fall than they have in the recent past. And then turn it over to my co-presenters who are going to talk about their experiences administering on-site working testing or on-site workplace testing programs, as well as on-site vaccination programs, and then speak to some of the mental health considerations and resources that are going to be critical to making sure your workforce feels comfortable, especially when they're returning to an office environment, maybe where they haven't been before. So, with Delta emerging, certainly there are many things that can be done to be prepared for the emergence of Delta. And when we think about returning to space, to office spaces, or repopulating spaces that maybe haven't been fully shut down, but have been running at a reduced capacity. There are things that matter, and we know that these variables make a significant difference in terms of limiting workplace transmission and really keeping your workforce safe. What's the duty of care to those who come to work to make sure that enough measures are in place that the work can get done, but you're also not creating an environment where you can have active transmission of what's really a highly transmissible variant. So, the first thing, obviously, that we've been hearing ever since the end of last year is the important role that vaccines play. And so, even though we're seeing some reduction in vaccine efficacy, certainly vaccination rates and the vaccination rate of your workforce matters. And we've seen employers really run the spectrum in terms of just making information available to employees about vaccines, all the way to actually requiring vaccines for those that would want to return to in-person work. The other key piece, I think, is symptom monitoring, especially as we're starting to see more evidence of breakthrough infections. Monitoring for symptoms, even slight symptoms in people who are fully vaccinated, will become important. So many workplaces had symptom monitoring programs in place during the height of the pandemic. Thinking about bringing those back and knowing and understanding some of the differences between Delta variant symptoms in fully vaccinated people and the symptoms that we have traditionally associated with COVID is important. So those who've been fully vaccinated tend to experience more cold-like or upper respiratory type symptoms. So congestion, runny nose, sore throat, maybe some fatigue. So those tend to be more of the symptoms that you see in people who might be infected with the Delta variant who are fully vaccinated. So being able to recognize and differentiate those things. Another key symptom is also loss of sense of taste or smell. And that does occur in fully vaccinated people who have or are experiencing a breakthrough infection. So I think that's another key piece to be aware of. Certainly masking, masking has become a bit of a controversial topic depending on where you are. What we do know around the science, though, is that especially in a mixed vaccination population, so let's say 50% of your workforce is vaccinated and 50% aren't, masking really affords one of the biggest protections in terms of limiting the risk of spread within an indoor environment. And so that's a useful tool, and certainly that also couples with ventilation. So knowing the ventilation of your spaces, have you looked at the ventilation characteristics of some of your indoor spaces? So if that's an open plan office or a conference room or a lunchroom or other areas where people tend to congregate, especially without masks, they may be eating in a lunchroom. Have you looked at that space? What is the ventilation in that space? What is the filtration in that space? Do you have 13 level MERV air filtration in some of those environments? Those are all things that we now understand really can help limit the risk of transmission in an indoor air environment. And we work with clients on a regular basis to look at the dynamics of a particular room or a particular floor within a facility to determine what a safe occupancy could be with or without masks, depending on the percent vaccinated in that population. The other thing is, de-densifying spaces. So, we may find that you can only put, 10 people in a conference room safely right now, depending on your vaccination rate and the air handling characteristics of that space. So that's another strategy that will probably continue to be one that's important in the toolbox over the next 6 months as we kind of move through this Delta surge and into the future. And then testing is verification of a lot of those activities. So is there a need for an on-site testing program, or what guidance can you provide to your employees through testing? And my colleague Avi will be speaking to that based on his experience in running some on-site testing programs at different employers and colleges in Minnesota. Next slide. I just want to provide a little background in terms of the Delta variant. Obviously, that's been forefront in the news, but I think it's important to understand why we're concerned about the Delta variant and why things are different now when they were before. So this slide actually comes from an article that was in the New York Times several weeks ago, but I think it's a good visual representation of just the level of infectiousness that we're dealing with when we consider the Delta variant. So the Delta variant shows up in that red box in that chart, and as you can see, that red box overlaps some other illnesses like chickenpox. The gray box is the original version, or sort of the wild type version of the coronavirus that we first started with back in the beginning of late 2019, early 2020, you can see there's no overlap between those boxes. So we're really dealing with a virus that's much more, and a variant that's much more infectious. So that bottom x-axis of this particular graph, the numbers are basically what are called it's the basic reproductive number. So if one person is infected, that's the number of additional people that they can spread the virus to if there aren't proper controls in place. So with the Delta variant, we're looking at the ability of one person to spread to 5 to 10 other people, depending on the conditions and the vaccination state of that group. Next slide. So this is a map of the United States in terms of vaccine status. We can see that there's variable vaccination status, and this is the percent of the population by state that has been vaccinated with at least one dose. We're seeing a surge of illness in the southeastern United States, where vaccination rates are less than 50%. Other parts of the country, for the time being, where those vaccination rates are greater than 50%, at least at this point, we're not seeing as much of a surge, although there are certainly some states that are starting to experience that. Oregon is one that has a fairly high vaccination rate, but also seeing an increase in illness at this point in time. So these are data that are important and that we'll continue to monitor, and important to employers to consider as well. What's happening in your local geography? What is the vaccination rate within your community? If that vaccination rate is over 70%, the likelihood that you're going to see a significant surge in that area is probably reduced. If your vaccination rate is below 50%, being prepared with some of these other risk mitigation strategies will be important. Next slide. And this is a figure that comes from a recent preprint from the Mayo Clinic. This came out just late last week, and it was talking about vaccine efficacy. So in short, the Mayo Clinic created about 23,000 triplet groups to compare vaccine efficacy between the Pfizer vaccine and the Moderna vaccine. And that came from a group of patients that would have presented within the Mayo Clinic network in the state of Minnesota. So a fairly large sample size. And what the data from the Mayo Clinic study showed was that in July, in particular, vaccine efficacy for the Pfizer vaccine had been reduced to about 42%, and for the Moderna vaccine, it was about 76%. So that's down from an original number of about 95% effective for the Pfizer vaccine and about 94% effective for Moderna. So we are seeing some loss of efficacy. There's different theories as to why that may be. But I think the important thing to know is that vaccination and a highly vaccinated workforce is certainly protective, but there are other strategies that will likely be needed in order to also reduce the risk of indoor air transmission in a work setting environment. Next slide. So we talked a little bit about air modeling. The MIT recently published back in May, 2 authors from the Massachusetts Institute of Technology put forth some information on being able to model what's the risk of transmission in an indoor air environment. So interestingly, you can play with different scenarios, and there's a link to this model in the lower left-hand corner of this slide. I'd certainly invite people, if you haven't had a chance to look at that, go play around with it. It's an interesting tool. And you can get very complex very quickly. This is a tool that we use with some of our clients to really look at some individual spaces and determine, what's the potential safe occupancy level if people are masked or unmasked, or depending on the vaccination rate of the group that might be in that space. But for the sake of this presentation, if we take a 10,000 square foot office, sort of an open plan office, and we don't consider vaccination rate, with masking in that space can support 500 people for 10 hours. Without masking in that space, with the Delta variant present, and if somebody in that group is infected, that space can only support that same 500 people for 18 minutes. So masking really plays a key role in limiting indoor air, the risk of indoor transmission. And this model allows for additional customization based on vaccination rates and the airflow characteristics of a particular space. So it's a good tool, and I certainly recommend people take a look at that if you haven't seen that. Next slide. I think if we click through, yeah, this is basically what that tool looks like in terms of output. So these are the examples that I just described. So 500 people for 10 hours. And then if we click through, it'll be 500 people for 18 minutes. So it allows you to really look at some of those spaces in detail. Next slide. And so how might the increase in other respiratory illnesses impact some of your workplace planning? Unfortunately, as we've started to come back together as society, it's not only COVID that started to spread more. We are seeing increases in other respiratory illnesses like the common cold or RSV, which tends to be more common in children, but we're also seeing increased cases of RSV in adults as well. And unfortunately, they share the same symptoms. And so being able to differentiate between someone who might be potentially infected with COVID and somebody else who has one of these other respiratory viruses will be critical. And certainly that also increases as children head back to school. I mean, kids are headed back to school in different parts of the country already. Here in Minnesota, where I am, the majority of students return later in August or in the first few weeks of September. So we are sending a population back into classrooms that for those at least 11 and under can't be fully vaccinated at this point. So symptom monitoring is and certainly will be important, as I've talked about. And one of the key things to, I think, reinforce with your workforce, especially if you're bringing them back to the office for the first time, is that if you have symptoms, you should really stay home and wait until those symptoms resolve and be tested. If somebody develops symptoms on site, having the capacity to get them tested on site is also a good planning tool to have in place. And with that, I'm going to turn it over to my colleague, Abhi Anli, who's the CEO of Homeland Health and brings a wealth of experience in terms of conducting on-site testing as well as on-site vaccination programs. So with that, take it away, Abhi. Thank you.
Thanks, Ben. Appreciate it. So just a quick background on myself. As somebody, I'm the owner of a company that does vaccination and testing programs. We've been doing this since pre-COVID times. We do a lot of flu shot programs, and as a result of COVID, we've obviously grown to do a lot more with community-based testing, employer-based testing, school-based testing, and then vaccination programs at large scale and scaled down to the employer, to the size of a single employer group. With the tools that Ben referenced, ventilation, masking, social distancing, vaccinations and testing, we're starting to see employers institute a number of vaccine and testing mandates. So from the federal government down to state and local governments, individual employers and schools, we're seeing some variations in policy and how people implement those policies. So I'll cover that as part of my talk. But first, if you're implementing a policy, there are some considerations to think about and to frame in the context of your specific situation and your specific employee base or school. So the first and foremost is, will you require every employee or contractor on site to be fully vaccinated? The follow-up question I ask to all of our clients is, if your best salesperson refuses to get vaccinated, are you willing to let them go? Are you willing to get rid of your best employees? The corollary to this question is, what systems will you have in place to verify that people are in fact vaccinated? And if they're not, what strategies will you put in place to mitigate the risk of transmission within your population? Another question to ask, of course, is, have you reduced any barriers that there are to vaccination? So across the country now, vaccines are readily available. All three types, Johnson & Johnson, which is a single dose, Moderna and Pfizer, which are of course 2 doses. They are available at every pharmacy, at many clinics. There are still some large community vaccination sites that are sponsored by state and local governments where people can get vaccinated. But often the barrier is not just that it's close, it's that we need to do more education. We need to reduce transportation barriers by bringing vaccine events on site. And we need to make people aware of public resources like information from the CDC, from the FDA, from the vaccine manufacturers themselves, and from trusted sources within the community. Often that includes culturally sensitive resources that are trusted within the communities that you're trying to reach. You also would need to consider, what measures will be in place to reduce the risk. So what policies will you have around masking, distancing, symptom screening, as been referred to, and testing. Testing has, of course, become much more accessible, and we'll talk a little bit about how you might use a testing strategy with your specific population. But it does ultimately remain, it is ultimately the best sort of indicator of disease, right? Symptom screening, masking, distancing are helpful at mitigating transmission, but knowing for sure if somebody is positive or negative ultimately determines a lot about how you're going to respond. And it may be true that vaccinated and unvaccinated population need to follow the same rules. So we'll talk a little bit more about some of the themes that are emerging as part of this, but it isn't necessarily the case that just because you have a vaccinated and unvaccinated population that you should treat them differently. I think we're still learning about how that might evolve as the pandemic continues to evolve. And the last thing I'll say is, most of us who have been doing this for a while have created contact tracing, risk mitigation, and business continuity plans. I think with pandemic fatigue and a summer that started to feel like we were on the other side of this, some of those policies have kind of been put to the side. And I would say that now, before the fall, before people come back to schools and to the workplace, is the time to really dust those off and make sure that your policies, procedures, and reflect kind of the new reality. The new reality is that we have this mixed environment of vaccinated and unvaccinated people, and we have this highly contagious Delta variant that we don't know exactly how it will continue to evolve into the fall. Next slide, please. So, excuse me. So, as we've been sort of talking to our clients and thinking about mitigation strategies for the fall, there are several themes that are emerging as far as policy and what is being implemented by different groups. So one of the themes is what I would describe as all employers, contractors, visitors, and students must be fully vaccinated. So it is essentially a pre-qualification for employment, continued employment, or participation in school, whatever it might be. So I would say that not many employers have gone this far. Those who do are really putting the needs of their at-risk and vaccinated population first. We're seeing this from private colleges and other organizations that are trying to create a safe bubble for in-person activities to resume in a somewhat normal way, with some of the other mitigation strategies also in place. This is obviously a strong statement, and one that, again, if you're implementing something like this, you should be ready to take on the downstream consequences, which might be that you lose some of your best people. I think that is a possibility in any situation like this, and one that needs to be considered, but it is also the strongest statement that you can make about what you're willing to do to keep your population safe. The second theme is sort of a gradation on that. So it's all employees should be or must be vaccinated, subject to, if they're not vaccinated, they would be subject to periodic testing, mandatory masking. This is essentially the plan that was put in place for federal employees. Here where we are in Minnesota, it's also the state's plan that all state employees should get vaccinated, and if they don't, they're subject to weekly testing and masking requirements. When you implement a strategy like this, it's of course important to have some form of validation of who is vaccinated and who isn't. For some of the clients we're working with, that is a very formal process, and in some cases it is a little less formal, trying to balance the privacy needs of the employees with the needs of the employer to kind of implement this policy and have it actually be meaningful. You must also create a realistic method of enforcement. So how are you going to create compliance essentially with your testing program if you choose to go that route? Or how are you going to create compliance with your masking mandates or distancing mandates? This is where we see a lot of interest from our employers, customers right now. Essentially, this is a program that requires some form of upfront validation and then ongoing testing, whether that is testing in a more of a community-based setting where you require the employee to go and get tested on their own, or self-administered rapid testing programs with either OTC, over-the-counter readily available tests, or some similar rapid testing methodology, or something more formal where there's an outside vendor that comes on site and essentially runs the testing program soup to nuts, and really takes that burden off of the internal resources to kind of staff the program, to create the ability to register, to create reporting, and all the things that go with creating compliance in a program like that. And it's really important to have a strategy that is defined and meets the needs of your population and, of course, your budget. Testing is not free if you bring it in-house. And oftentimes, you're balancing what is available from the community with what is available that you're able to provide directly. For the next slide, please. So the third theme I would describe as kind of hybrid or remote first. So I would call this more of a hands-off approach, but it allows employees to make decisions on their own for their own comfort level. So I've often heard this as work your way or some version of that. I would say vaccination in these settings tends to be encouraged, not required, and often it's not even really tracked. It's more kind of the honor system, so to speak. On-site workers often are asked to mask optionally according to CDC data on local transmission rates or other kind of markers of disease spread in their local community. And a lot of companies are just pushing back return to work several months or indefinitely. So we're seeing a lot of employers who previously were on a September 1 sort of a time frame, pushed back to October or even towards the end of the year. And then the last theme I would call fingers crossed, hope for the best. And honestly, this is more prevalent than one would expect. I think that there is pandemic fatigue, and there is a sort of a sense that, you know, those who are vaccinated, that's what we got. Those who aren't, you know, they're not going to. And, you know, we're going to kind of leave it on the employees to kind of use their best judgment as to how to keep safe. This, of course, you know, is not a preferred strategy, but it is one that we are seeing quite a bit. With relaxation of masking, distancing, capacity limitations, some organizations are just simply willing to look past those risks of Delta and what could be coming in the fall, and employ kind of minimal mitigation strategies around that. So when we talk to employers and they are sort of wrestling with these various approaches to testing, vaccination, masking, and distancing, you know, the things I always come back to are, you know, keep it simple and keep it consistent. So things change with COVID every day. Between yesterday and today, we've already been hearing about the need for booster shots, for example. So things change with COVID all the time, but keep your policy as much as possible consistent, so that it's simple and easy to understand, and that your plan is based on, you know, defined by all the available scientific evidence. You adjust as needed, but not on a daily basis. And, you know, with the transmission and positivity rates that we're seeing today, you know, the Delta variant is likely to impact communities across the country in very different ways. We're already seeing it, as Ben referenced, in the Southeast as a different, there's a different thing happening in the Southeast than is happening here in Minnesota or in the northern countries. Highly vaccinated populations are seeing a different outcome than less vaccinated populations. So you really need to balance all of those things and try to keep a simple, consistent policy as much as is possible. The second thing I would say is communication is really key to get people to return confidently. So if your goal is to have people back in the office, working together, collaborating, whether that's full-time or some part-time, it's really important to keep your focused as much on those who are vaccinated as it is those who are unvaccinated, and not have your policy simply just revolve around the unvaccinated portion of your population. And the key to that is really communicating to all about your planning, your choices, and importantly, what you're going to do to keep keep compliance with the stated policies that you put in place. And the last thing I would say is be willing to make unpopular choices. Masking indoors, mandatory weekly testing, these are not popular choices. These are not things that people would voluntarily do in general. But you really need to consider the fundamental risks to your business and how to bring employees along and communicate really clearly about what your policy choices are and why that's right for your business and for your employees. So I think it's really important that sometimes we, as business leaders, are afraid to say, yes, we want you to wear a mask, even though you don't want to anymore. It's sometimes that's the right choice to make to keep your employees safe and to keep your business moving in the right direction. So, and finally, I would say through all of this change and uncertainty, it's really important to consider how best to support your employees during this really difficult time. So our next presenter, Chris Kekol, is the founder and CEO of Advantage Health. She'll be speaking a lot about what employers can do to help their workforce take care of their mental well-being. And Advantage Health has a lot of programs in place that can really support employees as they kind of work through this difficult fall that we're likely to see. Chris, I'll turn it over to you.
Sounds good. Thanks, Abby. And you shared some great information. So it's no secret, obviously, mental health has been a huge challenge, I think, for all of us probably on this call throughout the past year and a half. And you know, as an employer, I think also we struggle with how do we actually, help our employees through this difficult time. Especially knowing that a lot of experts are saying that these mental health issues that are coming out because of COVID are probably going to be around for a while, even after the pandemic ends. So mental health is truly an important piece at the workplace, and it's a real issue. So I'm going to kind of just cover a few things here of issues that have probably arisen within your organization. And it really varies by employee, maybe more increased demands at home, isolation, obviously, we've all experienced with family and, loved ones. We've experienced concerns with finances and job security. A lot of us have had to change our job description or our workloads due to COVID. And just a lot of just general fears about COVID, uncertainties, a lot of skepticism out there. And unfortunately, some of us have actually dealt with a lot of grief. We've had loved ones that have passed away. And, we've had a hard time dealing with those types of issues, not only for ourselves, but maybe for our children. So the issues are real, the issues are out there. But because of these issues, mental health has never been more important at the workplace. In the coming months and beyond, if you're not already doing it already, addressing mental health and providing additional support and encouragement from your workplace leaders to your employees will be very important. And perhaps you might even want to think about maybe a new approach or maybe a renewed focus on just mental health in general. And that can be starting with awareness, bringing in education, and really getting mental health more accepted throughout the organization and something that's talked about and maybe not something that's seen as a taboo subject. Next slide, please. So how do we do this? How do we do this as employers? Well, first and foremost, education is going to be huge. I mean, we all read the newspapers, we all watch the news, we know, kind of what COVID is. So I don't think that's necessarily the issue, but it's more how to deal with COVID stress and anxiety. So I think on-site or virtual education is a huge opportunity for employer groups, and to provide those to your employees, maybe monthly or maybe quarterly, however it might fit in. But I think that is a great way to address some of these issues. And I'll talk more about types of topics to look at for your group in a future slide here. I also think that really focusing on your managers and training and really bringing them up to speed with the issues that their team may be facing because of COVID. So how to recognize that someone is struggling, how to recognize that someone might be depressed, having conversations, how to have appropriate conversations, I would say, with your team about COVID and about maybe the mental health issues that can arise from it, keeping that communication open. And I think too, training your managers on what resources you have available as a company, whether that be an EAP or maybe you've got a wellness program in place that offers information on stress management, anxiety, those types of issues. Maybe you have resources readily available through your health plan as well. So really getting your managers up to speed with the resources you have so that they can pass those along to their employees who may need them. I also think you can't communicate enough through educational postings and updates to your employees about COVID. I know there's a lot of conflicting information out there, so it is confusing. But providing all the information from credible resources that you've gathered and making sure those communications are accessible to everyone. You may work in an organization where not everyone checks their email every hour, or maybe even every day. So whether that's break room postings, departmental announcements, maybe it's even paycheck stuffers, but make sure you're really communicating in a wide variety of ways so that you're reaching everyone. Another thing you can do too is periodically survey your employees to check in on their mental health. An anonymous survey that maybe goes out via SurveyMonkey that asks people, how do you feel about COVID right now? What types of emotions are you experiencing? How do you feel about working at the work site? How do you feel about working from home? What are your challenges? And I'm sure a lot of you out there have already done this, but as we've mentioned earlier, COVID changes by the day. And so people's, I think, levels of comfort maybe even change by the day. So to be sure and stay up to date on how people are doing, periodic surveys would be good too. And then not only administering those surveys, but also reporting back the findings. I think people are very interested to know as an organization how everyone is doing, how everyone is feeling. And then if there are concerns identified in those surveys, senior leadership should be addressing those questions, those concerns in some type of feedback to all the employees. So those are important things. And then also don't forget to, partner with other departments or third-party providers within your organization. A lot of you out there have wellness programs in place. And so partnering with your wellness coordinator on stress management programs, resiliency programs, reaching out to your health plan, like I mentioned, your employee assistance program. A lot of employee assistance programs are underutilized, but they have a wealth of resources out there. So I would encourage you to really partner up and really, you're all working for the same thing, the same end game. So to really utilize each other and lean on each other in your efforts. All right, next slide, please. So what types of topics are we talking about when we talk about mental health and wellness? Well, there's a lot, and it's a much bigger thing, I think, than most people realize. But for most of us, we think of mental health, we think stress management, right? Which is a really big, broad term. But what we've seen as an organization since COVID really started was that building resiliency has been a huge topic of interest with employer groups, how to practice mindfulness. So I think talking about general stress related issues, but delving in quite a bit deeper, how do I deal with change? How do I deal with my kids and their anxiety with COVID? Building self-care. How do I build natural immunity through nutrition or exercising more, just being healthier overall? So it's really bigger than I think a lot of us think. And really, if we take care of ourselves through better nutrition, physical activity, healthy sleeping, being up to date on our preventive care visits, all of that makes us healthier individuals, which in turn makes us stronger against the COVID and COVID basically, and any variants that might come out of it. So when you're thinking of mental health, I would encourage you to think broadly. And here are just a few topics that are popular amongst our client group. Next slide, please. All right, that is it for me.
So we have now come to the question portion of the webinar. And we do have, and we'd like to thank Chris, Abhi, and Ben for their presentations. A great approach to discussing the multidisciplinary aspects. And we'd ask you to all come back on camera so that we can address questions as we go. I think the first question I've seen is for Abhi. So why is testing important in this approach? Have you seen the approach with only mandatory masking for unvaccinated?
Yeah, so that's kind of two questions. So I will answer the first one first. So testing is important because ultimately testing is the only way to catch asymptomatic or pre-symptomatic cases in your population. So all of the guidance from various departments of education, from the CDC really recommends frequent testing. For example, here in our home state of Minnesota, students who are in person are recommended to get tested at least once per week, for example. And the primary driver of that is that symptomatic spread is one way that the vaccine that the virus spreads, but it's not the only way. And so even with your vaccinated and unvaccinated population, with the unvaccinated population, transmission is kind of obvious. What we don't know as much is in the vaccinated population, what the levels of transmission will be. So I'll probably let Ben comment a little bit more on that sort of aspect of it, but ultimately testing, whether it's sampling or kind of broad-based population testing, is the only way to know for sure whether you have active COVID in your population or not. The second question about mixed masking policies. So yes, we've seen employers try to implement a mixed policy of only the unvaccinated must wear a mask. Those who are vaccinated do not need to wear a mask. What I would say is two things. One, there is evidence that those who are vaccinated can still, of course, get COVID. The vaccines are not 100% effective, and less so against the Delta variant. There is also evidence that vaccinated people can spread COVID. So it's early, and there isn't as much data about that as there is about the unvaccinated populations, but there are plenty of indications that it is possible for someone who's vaccinated to contract COVID and spread it to others. So I would say that there's that aspect of it, which is the science. The other aspect of it is just practically speaking, keeping track of who is vaccinated and who isn't in the general population is almost an impossible task. So it creates an environment of two things. One is us against them. So the vaccinated against the unvaccinated. It's not great for employee morale. It's not great for team building. It's not great for any number of reasons. And the second is that just being able to keep track of who's vaccinated and who isn't, and who's wearing their mask and who isn't, is a very difficult policy to actually enforce with any regularity. So I think that we've seen employers try it, and it's all relatively new. But the feedback that I've received is that it's easier and more, in some ways, more fair to just implement the same policy for everybody. But every employer is going to have to make their own decisions about that. And it's obviously a fraught conversation. There's not a simple answer to that.
Yeah, and I would add, I think testing is kind of the difference between knowing and wondering, right? So when you're trying to manage a workforce, especially if you have high transmission kind of in a surrounding area. So let's say you're in a place where the CDC defines it as a high rate of transmission, which would be about 14 cases on a daily average per 100,000 people, which is actually not that high, based on kind of our previous experience with COVID. those can be settings, especially if you have a mixed vaccination population where, testing the unvaccinated people, if you know the different, who is and who isn't on a weekly basis, can provide some assurances, to everyone in that space that, you're reducing the risk of people bringing the virus in. And those are the programs that you're seeing, I think, become more commonplace. Either government employers are starting to move in that direction, not just the federal government. Other employers are thinking about that model as well. I think another, in conversations with some of our other clients, especially in high transmission areas, is, if you have over 3% of your workforce test positive in a 2-week period, that may be another indication that there's enough circulating illness within the population. People are bringing it to work. And, that's a threshold where you might think about doing some kind of, testing where you're looking at everyone or a portion of the population, or, again, the unvaccinated people. But again, as Abby pointed out, unfortunately, what we're learning is that, someone who's fully vaccinated can still potentially transmit to others. So that was a definite change in our understanding of the science over the last probably month or so. So this is, again, what makes all of this a bit of a challenge. But those are sort of the conditions under which testing may be, a good tool to consider.
Yeah. The last thing I would say about it is that the cost of testing has come down quite a bit, depending on the types of tests you're using. So some of the over-the-counter rapid tests, although their sensitivity is not great necessarily, they're really intended to be used frequently, and they're intended to be used kind of for this sort of population screening. So most of the programs that we are implementing tend to be PCR-based nasal swab, either done in a lab or in some cases done on-site, rapid on-site testing, because it is more sensitive and tends to be more useful in that way. But that being said, that is a more expensive option. And so there are less expensive options available that could be used more frequently. That could also be self-administered by somebody at the company, could sort of run the program internally and do it with a kind of a cheap, relatively cheap, cheaply available test. A strategy like that could also be very useful and not super costly.
Okay, so another question that we have received, kind of based on the themes, but could be answered by any of the panel of experts, is, are you seeing any patterns in how companies are behaving regarding those various themes and what they're implementing?
Yeah, maybe I'll just go first, since that was kind of my slide. So the themes that I'm seeing most commonly, so I'd say theme number 1, which is probably the most, I would say, severe. I have seen that at some large employers. So here in Minnesota, the Minneapolis Federal Reserve, very publicly came out with that policy that anyone that works for and with the Minneapolis Fed that needs to be on site must be vaccinated. So they were very public about it. But I don't think it's as common amongst private employers. So what we're seeing more commonly amongst private employers is some version of theme 2 and theme 3. I think that amongst smaller employers that are resource constrained internally and in being able to sort of manage these programs on a day-to-day basis, we see number 4, theme 4 actually pretty commonly is hoping that the public health response will be enough to help them in their own internal response. Is really what that boils down to.
Ben or Chris, do you have any comments on that one?
Nope, nothing on that. That was good.
Okay. So the next question we have here, and if you all do have your chats open, you can see it's quite a long question, but it's based on an article that we had printed. And so, Ben, you probably would be the best to address this, but at the same time, it does need to be understood that this was David Acheson's opinion, and that there are a variety of different ways that this is looked at. So basically, he did say that the vaccine selection should be left up to the individual. and that other things should be considered, such as whether someone has had COVID or not, and what sort of immunizations that may have. And then just that the vaccines were designed against viruses that are not so much around anymore with the Delta variant. So would you have any other comments on that, Ben, or anyone else?
Yeah, I mean, I would just, yeah, I'll leave, I would let David answer for himself on that one. But
Right.
I think in general, it speaks to, those four different themes that we're seeing as well. And it's not an easy discussion. We have vaccines that are, not fully approved yet at this point. Based on the data that we have, I believe that they're safe and still highly effective, especially against moderate to severe illness. So, as a public health practitioner, I look at that data and say this is a good way to help manage the risk that exists from a new emerging infectious disease. And so, they're a tool in our toolkit, much as some of these other things that we're talking about are. And unfortunately, I think they're not necessarily going to be the panacea that we thought they were, maybe 2 or 3 months ago. So that said, I do believe that, having as many people vaccinated as possible, does provide community protection, just from what we know from an epidemiologic standpoint. But right, these are the conversations and debates that I think, are happening in boardrooms and, in HR offices, and, trying to balance the science against the risk and really understand, within the culture of your organization, what makes the most amount of sense. And in some instances, vaccine mandates may be, what is the best choice. We work with a number of colleges, and in a congregate living setting, the risk profile is different than it is in an office. So, in terms of the risk of transmission. So we have to take those variables into account as we look at, what the appropriate tools are. That's how I would address that.
Okay, and we have time here for one more question. And basically, it has said that according to CDC, the US has 358 million doses of vaccine have been given, with 169 million, or 51.5% of the US population fully vaccinated. Given that, how is it possible that the 2021 COVID death rate is on pace to equal or surpass the 2020 death rate?
An epidemiologist question, so get that one. It is a good question, although I do think it shows that there's still a significant portion of the population that's largely naive to this virus. Not included in that total are those that probably did have a natural infection, and there's obviously an overlap between those who have had COVID and the portion of the population that's been vaccinated. It's certainly not 1-to-1. Is it 50%? I don't think we have good numbers on that, but that still means that there's a significant portion of the population that has not previously had COVID and therefore is really susceptible to a highly transmissible variant. I mean, we have to remember that, or, it's good to think about where the Delta variant came from. We first saw it in India, and it's been sort of genetically linked to the surge that happened in India starting in late March into kind of mid-May and a little bit beyond. The virus evolved in a very unvaccinated population in India. Only about 2 to 3% of the population at the time in India was fully vaccinated. So therefore, this variant didn't evolve under what we would call vaccine pressure. It evolved to be very effectively and efficiently transmitted in an unvaccinated population. And that's where we're seeing the most significant amount of spread right now in the US. So for the half of the US that has, still, or a little less than half that still is unvaccinated, what we're seeing is that people can be reinfected, or if you never were, now you're infected with a highly transmissible variant that produces a lot of virus. And that seems to be causing hospitalizations in younger people at a higher rate, 2 times the rate, with ICU admissions at about 4 times the rate that we saw with the original wild type variant. So in a way, it's a bit of a perfect storm, for that population. But right, I mean, this is something that's obviously concerning, is that we're, potentially going to see more mortality out of this fourth wave in the US than we have previously. And we still have, we have tools available like vaccines that can really blunt the effect of that.
Okay, well, we are just about out of time and we don't want to go over our allotted time. So I would like to once again thank Ben and Avi and Chris, and thank the participants who joined us on this webinar. We hope that you've gained some additional knowledge on the state of the pandemic, the multidisciplinary approach to protecting your employees and your business. So in follow-up, we will be sending the recording out to all who registered for this, along with a workplace communicable disease checklist that was developed by the 3 groups, and through which you can then begin to assess your own business preparedness. So feel free to contact any of our experts for further assistance, and we'd like to thank you again for participating. And this ends the webinar. Thank you.